Hello everyone, I am Dr. Yogesh Agrawal from 1975 MBBS admission batch. I am now a practicing orthopedic surgeon in Dubai. I would like to share my sincere regards to RSM on his centenary celebration. One of the greatest teacher and clinician I came across in my journey as a doctor. First, I would like to share my fond memories of him as a teacher par excellence. I was probably in third year MBBS, just starting clinical rotations in a ward round with him. There was a teenage boy, and we as students were asked to observe his gait wearing shorts. We could not make out, except for that the child is walking with an awkward gait, both heels off the ground, nothing else. He then asked me to look at his calf muscles, which appear to be large and strong due to their size. Finally, RSM asked the child to sit down and stand again. To our surprise, the child could not do it, but instead struggled to climb up only onto his body with the help of his hands before becoming erect. That is how we learnt about the Gowers' sign, one of the classical diagnostic signs of muscular dystrophies. This has been imprinted in my mind ever since. As an orthopedic surgeon, I use it routinely to confirm my doubt of early cases of Duchenne's muscular dystrophy. I would say he never missed any opportunity to make his students learn, frequently demonstrating clinical examples which made learning fun. One more such pearl taught by him early in student days was that don't waste your time and patient's money on suspecting and investigating for rheumatic fever after age of 18 years, which does not exist or is extremely rare. Instead, focus on other causes. This made me confident to not ask for ASO tutor in such situations. Now, as a clinician par excellence, there are innumerable such examples in my knowledge where his opinion changed the course of treatment altogether, but difficult to quote them all. I would like to quote one such example of my own case. At age of 8 years, I was diagnosed with thyrotoxicosis due to some abrupt onset symptoms and was prescribed tablet neomercazole by an endocrinologist. When I saw him for second opinion, he advised me to check for thyroid antibodies, which came out positive. Diagnosis was revised to Hashimoto's, and he concluded no neomercazole, only propranolol if tachycardia is bothersome. And after I become hypothyroid in the future, then get treated accordingly, which did occur as he said. I distinctly remember when leading orthopedic surgeons were unable to make a diagnosis themselves, they would ask the patient to take his opinion because of his overall supremacy in clinicals. One such shocking case was a pelvic bone tumor diagnosed by RSM, missed by the referring orthopedic surgeon. While working with Dr. K.T. Dholakia at Bombay Hospital, I realized there was hardly any clinician available who could handle problems of multiple systems of disease. You had to refer patients to various super specialist doctors whose input would create a lot more confusion regarding their management. While in Indore, we had his resource to resolve whenever in difficulty to make correct diagnosis and decide the direction of management. We are fast losing teachers like RSM for our future generations. Very few bother to do a thorough history and clinical examination anymore to make a diagnosis followed by investigations. Current trend is investigations first, followed by diagnosis as per the results. I try my best to follow and pass on his legacy of teaching to the next generation at every possible occasion. I wish him continued interest in his clinical workup of the patients whenever he is called upon to opine. I pray Almighty God to grace him with continued excellent health and a sharp mental acumen for him to grace us with his blessings. Thank you.